Hello. You know, people don't actually commit suicide because they want to die. They see it as a way to end their emotional suffering, and when they get to that point that they want to commit suicide, they can't see any other viable way. It's so unfortunate that this has taken a toll on healthcare workers, and the numbers keep rising on every week. So in general population, physicians are 40% more likely to die by suicide. And in a study that was conducted in 2018, it showed that nurses in general population were likely to die by suicide by 18%. And that number was doubled when it comes to female nurses. That is to mean 36% of the general population. And that number was 70% higher than the female physicians. So nurses, you see what I'm talking about? We're really endangered here. In a study conducted again, 300 to 400 medical doctors die by suicide. That is in the US, and that is double rate of the general population. We're talking about yearly numbers. So in general, it was summarized that healthcare workers are at risk of death by suicide than all the other occupations. Other occupations that were mentioned there included, the one that shocked me so much was farmers. But I mean, I would understand, especially with this bad weather. It's so hot and there is no rain in Africa at this moment. So I would understand that. So there were farmers, there were electricians, there were real estate agents, amongst others that were mentioned. But the leading one was the medical doctors, dentists. There was somewhere where they mentioned pharmacists, lawyers, financial services, veterinarians, policemen. Those were the top 10 that were getting discussed in that forum. So I then went to look at the, causes of this rise in the numbers of these deaths by suicide amongst healthcare workers. And the first one was the socioeconomic pressure. There is these expectations by the society, and they are held so highly, towards us. Like once you graduate from med school, once you graduate from nursing school, from, once you're a dentist, all those things, the pharmacist, lab technologists, these pathologists, there's just these expectations that the society has, these high expectations, especially about living. They expect you to be really rich, a lot of things, and it becomes worse even in the family. Just your nuclear family there has these really high expectations. Probably you're going to get out of some debt they had, they say debt they had, some, maybe get them a little bit higher. These expectations, you understand what I mean, right? And then you're likely to be more frustrated if you cannot deliver, because sometimes we come into the field and then we expect that we are going to be making a lot, and then it's not as you were expecting. So it might come as a shocker to you, and it might be a trigger. And also, what was the other thing? Like time, yeah. You've set your own goals. You've set to have accomplished this by this period of time, and then you're not able to. And this will revolve because we revolve around things like probably you had loans at school, you need to pay those off. So there is likely to be a delay after you've now secured employment, and you shouldn't put a lot of pressure on yourself because of that. And now it becomes more hard to explain to these people that now assume you're rich that you do not have the money that they think you have. Sometimes you might even get into debt, a lot of loans, and it doesn't look so good on you because you are a doctor or you are a nurse. And all these things might be triggers to that, to suicide. The other cause is gambling and drugs. So a lot of people have gotten into gambling. It doesn't have to be, I know of one way, which is that football thing that people, Spotty Bet? What is it? I don't know. There's that thing. People are likely to get into that and worse things to get more money, to get out of their debts or their loans. But it gets worse once you start gambling. I had the road to recovery after you've started gambling can be difficult, but there is a road. And then the drugs come in. You see, sometimes you do not have a social life. If you're a nurse or you're a doctor, mostly you do not have a social life. Your life revolves around work, and then you come back home. You might not have someone to share with of the things that you experienced at work. Maybe there was this diagnosis that was too hard for you to tackle, or you lost a patient and that didn't go so well with you. So you might think that taking drugs is going to be okay, it's going to be fine. Subsequently, there are side effects to these drugs, or there are effects to these drugs. Some of them are hallucinations, and you could commit suicide based on an effect of a drug. And the other one is now when you realize that the drugs are not working. You're still going through, the work pressure is still there. You're still not doing so well socially, economically, and these drugs are not really helping. So why not end my life anyway? So that is another thing. The other thing is jobs. So in Kenya, these are two. I don't know what happens in other countries. I have just realized in Kenya it's hard to get work. This problem was not there. So let me just say before I start going everywhere. So lack of jobs can cause a healthcare worker to commit suicide. And the other thing is lying in the job itself. Like, you have this job, but it's just not conducive. So let's talk about lacking jobs. A long time ago, you remember when the county government didn't handle healthcare workers? Like before health was devolved as a function. I think life used to be easier. But nowadays, even medical doctors, can you imagine? Even medical doctors they are not getting employed easily in Kenya. It's hard. I don't know who is going to help us out on that one. Since health was devolved to county levels, getting employment has been the hardest thing any healthcare worker can go through. So this kind of a thing can cause someone to want to take their life, to just stop suffering. Because you imagine someone just graduated, probably they started by help or through help, and here they are, they're not getting work. And there's pressure, a lot of pressure from family, a lot of pressure from friends. And then they know you're this doctor, you're a doctor. No, you're not a doctor in quotes, you're a doctor. So the community knows that, the society knows, everybody knows that. So the expectations are quite high. And you're likely to get that pressure and probably, take your life. Just stick around to things that I will talk about, how we can kind of reduce this suicidal rates. Don't go far away, okay? Until we get there. So the other thing is pressure from jobs. The crazy working hours, the crazy workload, all these can, and then sometimes you can have a very toxic management. So all these things can cause you to have some mental breakdowns. And remember, it doesn't mean, just because somebody is a healthcare worker doesn't mean that they cannot have underlying mental health issues. Some of them have underlying depression, some of them have underlying anxiety issues, a lot of things, a lot of probably mood disorders. And once this whole job thing comes in, or the whole socioeconomic factors come in, then they are likely to trigger or to make the underlying mental health issue worse, hence, causing the suicide now. You know how hard it is for a patient to come forward and say that they think they are experiencing mental health issues. I can tell you one thing for sure, it is worse in the medicine field. There's a lot of stigma, a lot of social stigma. So people are afraid to come out. But there are things that we can do, like employers, like employees, to make life easier for our medical doctors, for our physicians, for our nurses, for our pharmacists, dentists, HRIOs, all of those, so that we help lower these numbers of, suicides by our colleagues. For example, organizations or hospitals can come up with forums to help address these issues, but then these forums should offer the highest levels of privacy. Like if someone comes up and says, so for example, I'm not spam. So if I come to you as a psychiatrist, please ensure that the privacy is upheld. Don't discuss my things with another person. You understand? One of the financial barriers, this should be removed. We should have forums, maybe lower the amount of money somebody is going, a healthcare worker is going to spend talking to a psychiatrist or to a psychiatrist, and this should be easily accessible. So, like for example, if an organization or a hospital does not have a psychiatrist or a psychiatrist to deal with medical doctors or physicians or nurses, if they do not have one, I think we should probably, they should have, even if they do private practice, these services should be made available to these employees, you understand, like to those healthcare workers that are working in your facility, and make sure that the services are affordable, they're accessible, and a lot of privacy. Please, privacy. A non-formal way to reduce these numbers is having peer support groups, and then we can have ways to reduce time and task burdens that are imposed by these busy schedules, and that would mean to reorganize maybe the practice designs. Probably, you see, we work like it's a lot of computers, a lot of just a lot of everything. If there's a way that was made manageable and that would reduce time, then being so much busy would also reduce. And in that line, we have talked about, I think I've ever talked about meditation and mindfulness, I think in my mental health video, that really helps quite a lot when it comes to reducing stress and burnout. The other thing is amongst ourselves as colleagues, as healthcare providers. You see how there has been this notion about if you see someone is distressed and you realize they could be having an underlying mental health issue, and you ask them, or maybe you try to talk to them, or maybe you see signs that they want to commit suicide and then you want to talk to them, there's this notion that has been like, or this belief, or this myth, actually I'll call it a myth because it's not true, that if I ask them that, they're likely to do it. No, on the contrary, it doesn't work like that. It doesn't work like that. It has been proven that if you realize that somebody, especially now this is a key thing. You have to be in a respectful kind of a relationship with this colleague of yours to even be able to take this step. Otherwise, it will backfire. So if you realize that a person is having these suicidal thoughts or suicidal ideas, or it's just something that you're seeing and it's selling it off, it's just selling it off, just inquire about it. Inquire about it. When somebody knows or realizes, oh, there's somebody that actually cares, it might stop them from making that decision of wanting to commit suicide. And if you're in Kenya and you're a medical doctor, I know it is worse nowadays. It is worse, and I'm a nurse, and it is not in my place to even be talking about this. But try to talk to people that have been before you, that graduated before you. Okay? Ask them about the job markets and what they can do. Most of them out here are surviving by locums. You do a lot of locums, and then probably an organization feels that now they can employ you on contract or permanent basis. So try to inquire about it. Don't graduate and then look for work, and then there's no work, and then start getting depressed. No, please don't do that. Talk to people. People that graduated before you, or people that are in your class. Most of them could be working. So try to be in those groups where, I don't know which groups you guys are in. I know in nurses, there's nurses for each other. I don't know if the doctors, I am not sure. Mnakuwa kwa groups gani, by the way. So hizo groups, I'm so sure unaweza pata jobs uko. The same thing to dentists, the same thing to pharmacists. Your classmates, people that graduated before you, are the ones that are going to help you get a job now that the government is no longer doing placements. It is what it is until somebody goes there, and I think that whole thing is amended. Meanwhile, I hope you understand that life unfolds. Sometimes you have to let it happen, and do not put a lot of pressure on yourself. The society, the community, your family might want to put that pressure on you, but do not let it get to you. Because once it does, and you're a medical doctor and you're seeing other doctors are driving and you're not, it is going to get worse. And you cannot live life the way, like based on other people's footsteps. You have your own life to live or life to lead. And it can only get easier. It can only get easier. So you just be hopeful of the situation that you're in, and don't give up. Please don't give up. And I know that physicians and other healthcare workers are not even likely to go and see a psychiatrist or a psychiatrist, because they feel I can just manage myself. There's a saying in Swahili that says mganga hajitibu, mganga hajigangi. That means that a doctor cannot treat themselves. Sometimes, even if it is just a normal diagnosis like gastritis, like you need somebody to talk to. You need somebody to help you out with reasoning, So do not be shy. Do not be shy to go there and look for help. or feel the stigma that, oh my God, now I'm a doctor, oh my God, now I'm a nurse, and I'm going to look for a psychiatrist to help me. How does this look on me? Darling, it doesn't look any different on you. If you allow that to get to you, you won't get the help that you'll need, and you're likely to get into a worse mental state if you're not getting the help. Please try and get the help that you need. If you have underlying mental health issues, always have subsequent visits with your psychologist, psychiatrist to keep you in check, to make sure that you're doing well. You know, they're able to identify when it's getting worse, when it's getting better. They're able to identify the triggers. They will advise you accordingly. Don't shy because you're a physician to go get the psychiatrist help that you need, the psychology help that you need. Okay? If anything, you guys are the most busy people that you know, and you need that. Nurses, we know that you're the busiest persons that we know, guys. Taking care of another human being is not easy. Making sure that you don't mess up with medications, dosages, and dosages, yeah, it's not easy. Balancing your work and personal life is not going to be easy, especially since it's, you know, I know once you're working in a hospital, it's like you're married to that hospital. It's not going to be easy, but do not let yourself drown. Your family cares about you, your friends care about you, and please try to care about yourself. It's important that you care about yourself, even if you feel that nobody else does. Okay? Otherwise, I wish you a good day, whether you're having a good day, and this is the end of my vlog. Kindly subscribe to my YouTube channel if you haven't, and I hope to see you in my next video. So goodbye.